Well, South Africa's health sector has transformed in the last 30 years, but continues to be riddled with challenges, from underfunding to the lack of access to adequate healthcare, particularly in some of the remotest areas of our country. As government continues to push for the implementation of a national health insurance, what is the state of South Africa's healthcare sector after 30 years of democracy? Dr Mvuyisi Mzukwa is the chairperson of SAMA. Professor Benjamin Smart is the director of the Centre for Philosophy and Epidemiology, Medicine and Public Health at the University of Johannesburg. They're joining us on Zoom. And then Dr. Cedric Sihlangu is the General Secretary of SAMATU, it's a trade union. And Dr. Donald Gumede is a GP, a practicing GP. And they all join me now to answer what is a complex question. I know it is. It's got so many different layers. And I want to thank all of you for your time and your availability this morning. As always, we have the challenge of the clock, but we'll do our best to have a seamless and quite a, quite an interesting conversation. So, Prof. Swart, I want to kick off with you because you want us to consider the context of healthcare provision in South Africa, who had and who didn't during apartheid. Why is it important to go that far back in answering a contemporary question?
I think it's important because whilst things may not be wonderful at the moment, and they're not, let's be honest, we have to understand that prior to 1994 and going way back to the 19th century, things were significantly worse. Pre-1994, the system was set up so that the healthcare system was run by 400 local health authorities. It was very decentralized, and that led to significant disparities in healthcare. We need to give credit where credit is due. And what the ANC did was to consolidate that, create 9 provinces with more sort of consolidated power. And they made progress in that respect. And they built a lot of clinics. A lot of people that didn't have access to mainstream medicine do now. And of course, following Mbeki's initial disastrous policies regarding HIV, we now have one of the best ART, antiretroviral treatment programs in the world. So I think it's important to recognize the achievements as well as highlighting the problems.
Well, let me come to you, Dr. Mzukwa, from SAMA's perspective. I mean, we can talk about NHI, and I know that it's been a huge sort of thorn in the side of many sectors of society, including SAMA, about the rollout and the challenges that government is likely to face in its implementation. But maybe you can kick us off with your topographical view of the state of health 30 years into democracy.
Well, thank you so much for the opportunity, and greetings to your viewers and the fellow panelists. It is true what has been said already, that there are positives in the healthcare in our country, especially when it comes to ARV rollouts and stuff like that. But I think we have also declined on some of the issues that we thought we have a handle on, like the issue of immunizations. Where you find that there are no stocks in the clinics, but also there is no, people are not taking immunizations, especially children, that are supposed to be immunized. But there's many other issues. Also, we still have a large number of people, especially in the rural areas, who don't have access to healthcare. They don't have clinics. They don't have hospitals. Even if you were to bring that NHI, it's not going to bring hospitals in those areas. Even those clinics, they won't be built by NHI. So that is why we insist as the South African Medical Association that we do need to attend to these matters so that when we come to the implementation, we've got everything that we need in terms of provisions. We can't just be throwing a paper and say, oh, well, we're done now, we've got the NHI. So the other issue is the fact that we've got a number of issues that we still have to attend to. We've got a dire shortage of healthcare workers, especially those that are serving in the rural areas. Recently, we know we've got doctors who are not employed, yet we've got a dire shortage. 0.3 per thousand doctors in the healthcare in the public healthcare sector. And whilst the private sector looks overpopulated in terms of the World Health Organization. So those are the issues that we're highlighting to say, even though there might be positives, but the majority who are in the rural areas are not enjoying the freedom. They are not free from poverty. They are not free from disease. They are not free from, accessing services.
Right, Dr. Mzukwa, thank you. I want to bring it to you, Dr. Sihlangu. You can't have healthcare without medical health professionals and practitioners. This is what's already been said. But we are sitting in a situation in South Africa today where hundreds of doctors are unemployed, taking to sleeping in the streets even to protest and to draw attention to their plight. Why does the country, as we've said, with such a grave healthcare need, have so many unemployed doctors? And how much does this speak to the history of the evolution of healthcare in South Africa?
Thank you very much. I think firstly, to start off with where Prof left off, I think he really captured it quite well, that indeed there's been a lot of positives that have come out of the past 30 years of democracy. However, there's been a lot of missed opportunities, and while we're finding ourselves today with so many unemployed doctors, we have a government that says to us, look, we had to respond to the need to produce more doctors because, of course, for the longest of time, until today, we don't have enough healthcare practitioners, professionals. So they then ramped up production, increased training of doctors locally in the country, sent students to Cuba to train, others in Russia and in other countries. And what that has done, it has significantly improved the production of doctors in the country. If you compare that to 20 years ago, 30 years ago, we've got more doctors now coming out of medical schools than we did back then. Where government has somewhat been sleeping on duty is failing to plan beyond just the training. And what that means is, what ought to have happened is part of the training should have resulted in creating the job opportunities for those who then qualify. Because it's one thing to train a student to become a doctor and another thing to actually have them work as a doctor. So the missed opportunity there is for government to actually create the employment opportunities. And that's where we think that there have been good opportunities, but there have been some missed opportunities. And we believe that it's not all is lost, and we could still change the set of sail by ensuring that we create the adequate employment opportunities, because these doctors are the ones who are meant to actually serve the poor, the marginalized, and the far-flung communities. And
I'd love to allow the rest of our panelists as well to have a view on that, on this missed opportunity. And you do have the human resource. It is there. It's a matter of just connecting them to that opportunity. So just kind of, put that in your margins, and hopefully we'll come back to that. But Dr. Gumede, as a general practitioner, what is your view of the quality, the availability and the accessibility of healthcare, especially for the most vulnerable and poor, these 30 years into democracy?
Thank you very much. I'm going to answer it shortly and broadly. Also, we represent National Healthcare Professional Association. I'm the founder of that association, which represents doctors, nurses, your pharmacists and whatnot. So we're an organization that actually exists. Now, coming back to the question that you have just answered, you have just asked. Health, it's in 3 tiers, and many people, I think, all the panels, they're articulating that. It's in human resource, okay? It's in infrastructure, and then it's in your medicines. And we have failed dismally, we must be honest. Even now, people are planning to toy on the streets, the cancer patients, because the facilities of radiation have collapsed. So that's infrastructure. You see, your infrastructure, you're looking for your CT scans, your MRIs, and all that. Human resources is what they've addressed, which is the doctors, the nurses, the pharmacists, the physiotherapists, and all that. But let me go back a little bit so that I address the question of the 30 years. You see, 30 years ago, we did not have 2-tier health system. We had one health system. Now we have got 2-tier health system, which is private and public. And the public one is underfunded, to be fair, when compared to the private sector. Because the private sector only caters for 14% as we speak now of our general population, whilst the public is carrying the burden of the 86%. And majority of the budget that actually is pronounced in Parliament, it end up in salaries. That's why they can't employ doctors. Dr. Sihlangu knows we are in other committees together where we discuss these things. Now, those doctors, they needed 1.3 billion just to be employed just for 12 months. What about after 12 months? So my analogy about the whole thing is our government, they are staying in a shack and then they're talking about triple story when we come to NHI. Fix your shack first, and then let's see if you can build a proper house before you can move into the triple-story housing. And we have a problem because our poor people now, they promise wrong things which are not going to happen. And if indeed the government is serious, let's fix the basic, because even the standards that are needed for NHI to work, our current clinics are not adequately equipped to do that.
Well, let me put that to you, Professor Smart, as well. In your research, it seems, it's about getting back to basics. You heard the analogy, government trying to build a 3-story building or wanting to live in a 3-story building, but operating from a shack effectively. What are your thoughts on that, on how we do create proper healthcare in South Africa that is affordable and accessible for all?
I think it's incredibly difficult to achieve because of the reasons that we've already spoken about, budgetary problems. So to put it in context, the NHS, the UK healthcare system, has a budget of over 4,000 billion rand, right? The health budget in South Africa is 62 billion rand, or just over 60 billion rand. So they have over 65 times as much money to spend on servicing a similar size population. Now, healthcare is cheaper in South Africa than the UK, but it's not 65 times cheaper. And even in the UK, the NHS is crumbling. So, I mean, really, the big problem is money. There's just simply not enough in the healthcare budget to fund what the government are promising with the NHI. And also, I feel like there seems to be some kind of electioneering going on here. I mean, the private hospitals are at 70% capacity now. Even if they were at 100% capacity, that would, let's say, they would be servicing 20% of the population instead of 15% of the population. Well, that still means that 80% of the population are being treated in the dysfunctional government hospitals. And on top of that, all the taxpayers would be thrown into a sort of a healthcare lottery. Yeah. And frankly, for the middle class, healthcare is a bit of a deal breaker. So, the tax base is just going to erode. People will run for the hills. I mean, I can't speak for everyone, but I don't think I'll be hanging around in South Africa if my family's at risk of not being able to receive adequate healthcare. So I entirely agree. I think government needs to get its house in order. It needs to stop with the corruption. We lose a lot of money to skinny jeans at Tembisa Hospital and countless other examples. And fix the government hospitals first before, this NHI plan is, I think it's politicking, to be perfectly honest. I heard
a ripple of laughter here in the studio when you made that quip. I want to quickly go to Dr. Mzukwa, just a quick rating on where South Africa is now, and I'll ask the rest of my panelists as well, just a quick rating out of 10 on where South Africa is now when it comes to health provision, adequate, effective healthcare provision in the country, and maybe just one quick thing that government can do to turn the picture around. Dr. Mzukwa, we'll start with you very quickly.
Okay, thank you so much. I believe that we are sitting at 4 over 10 because of the reasons that I've mentioned. And there is obviously a need for a reform in the country. And I do think that without, rushing to elections and using NHI, because we have nothing else credible that we can point to the electorate, I think we need to really sit down and also implement some of the things that have been suggested in the Presidential Health Summit. Thank you.
Right, it's Dr. Sihlangu.
Thank you very much. Not to necessarily go into the numbers, but I think from our perspective, indeed, there's a lot of opportunities that have been missed, as we've indicated, but we are very optimistic that things can get better. One of the critical points that we view as a potential to change is to start with the implementation of the NHI, albeit in bits and pieces, so that we can start to actually implement change. Because currently we've been discussing and debating this for the longest of time. We believe that it's time to actually start combining the health sector, making it one sector for everyone, including bringing in the private healthcare providers to provide healthcare to everybody. The current situation where private is only for the minute, those who can afford, we find that untenable and almost against what the Constitution provisions say in terms of Section 27. So we view the need to actually have one system that caters to all.
Has it a number?
Well, we'll just borderline 5.
Okay, Dr. Gumede, final word, quick.
I think I'll give it a 3 because you see.
Oh my goodness.
Dr. Sihlangu is being modest about it because you see the current people who are involved in NHI, they stay without salaries. You know, the guys who are doing the pilot studies, they're not paid. And there's just so many problems in it. And again, how do you reconcile the point that I'm going to say to you? NHI is from national government to municipality. It doesn't include the provincial because the provincial government is run by the provinces. So as it is now, NHI, it's like that. So
give me a quick rating, Dr. Gumede.
3
Oh, yes, you did. You did already.
Sure.
I was gobsmacked.
Sure.
Thank you to all of you. I know we've been up against the clock. Appreciate your presence and your time and your perspective today. Thank you so much. We'll have more news.